And with Sparkle and Shine Health and Fitness, and I'm excited to jump on with you tonight to talk a little bit about tetanus. So, my first question for all of you watching out there are, when was your last tetanus shot? Who can tell me when your last tetanus shot was? Like, not exactly the date, like the month and the day, but the year that you got your tetanus shot. Because it is amazing how fast time flies, and you think you got a tetanus shot yesterday and it's already been 12 years, right? Time flies. So my challenge and my question is, when was your last tetanus shot, and is it current? Okay, post below for me if you know when your last tetanus shot was. A lot of people can tie it to something like, oh, I stepped on a nail in 1996. No, that you'd be out of date, right? But you can tie it to something. So if you can tie it to something that helps you remember, but post below for me when your last tetanus shot was and if it is current, okay? So today we're gonna talk a little bit about tetanus. So what exactly is tetanus? It is a bacteria, and what happens is these spores live in the dirt, they live in the dust, they live in manure in the ground, right? And when these spores get inside the body, they turn into bacteria, okay? So that kind of tells you how it is spread, right? And how you get it. It gets into your body through open wounds. Most generally, people think of tetanus shots when you step on a nail, right? Because nails are dirty. Anything you step on dirty. Puncture wounds are one of the common reasons for tetanus possibility. Burns are another big chance of possibility of tetanus because you have these open sores, right? These open wounds with burns, especially when you're losing that dead skin. A lot of people in like car accidents, when you have like crush injuries, are at risk for getting tetanus. So anytime anybody comes to the hospital with any type of injury, that is one thing we ask: when was your last tetanus shot, right? Because it's really important to keep those tetanus shots up to date. So next we're going to go ahead and we're going to talk a little bit about what some of the signs and symptoms are if you would get tetanus, okay? So I think most people think of tetanus as lockjaw, right? That's the one big common thing that most people think of, which is a big common symptom. What happens is these muscles get tetanic and they tighten up and your jaw literally locks up, right? Well, what happens when your jaw locks up? A lot of things can complicate, right? You can have problems breathing, you can have problems swallowing, you can have muscle spasms because those muscles are so tight. The jaw doesn't have to be the only place. All over your whole body can get tight. You can like literally just stiffen up and you can't move. It is that crazy. The other symptoms that you may have with tetanus, but not always, are like maybe a fever, headache, seizures. We talked about trouble swallowing. You can have changes in blood pressure, your increased heart rate just because your body's fighting infection, right? And so it can really lead to some serious complications. We talked about the muscle spasms, the trouble swallowing. You can end up with breathing problems because, right, it's all your airway, lockjaw. You can end up with pneumonia because you're not breathing deep, because you're not able to pass air. There's so many different complications that can happen. Sorry, somebody was at the door. And so what is the treatment? It requires hospitalization. It requires antibiotics. You might also need antispasmodics, so like Flexeril, Norflex, those muscle relaxants, because you're having those tight muscle spasms. Obviously, wound care for however you contracted the tetanus, those spores, that bacteria, taking care of those wounds. So what is the prevention? Yes, we all know you have to get your tetanus shot, right? That helps prevent it. And I did talk in my other series that no vaccine is 100% preventable. Most of them are around 97% effective. So there's still that chance you could always get tetanus, but it really decreases your chance, right? Your risk. So the vaccine schedule for tetanus is babies get it at 2, 4, and 6 months, and then they get it again at 15 months. Then whenever those kiddos get their physicals, right? So when they enter kindergarten and when they enter 7th grade, both those years they have to have physicals for school, and that's when they get another tetanus shot. Then for us adults, it is important that every 10 years we routinely get a tetanus shot. Yesterday I talked a little bit about pertussis. The CDC has recommended that we get a pertussis shot booster once, okay? So if you haven't had that booster of tetanus that had pertussis in it, make sure you get that. But then after that, you go back to your routine schedule of every 10 years getting a tetanus shot, okay? So that is my challenge for you today, is to find out when your last tetanus shot is. Do you know when your last tetanus shot was? So post below if you know and if you are current. Otherwise, I challenge you to find out. Thanks for jumping on with me tonight. See you guys.